President-elect Trump rattling Washington this week with some of his cabinet nominations, including Robert F. Kennedy Jr. as Health and Human Services Secretary. Puts his controversial views right back into the spotlight. Well, joining me now, Johns Hopkins professor Dr. Marty Makary, also the author of Blind Spots, When Medicine Gets It Wrong and What It Means for Our Health. Doctor, good to have you back on Fox
Good
News
to be with you.
Sunday. Okay, you've spent time with RFK Jr. You know his controversial views. You know what critics are beating him up about right now. A piece by an MD over at the Washington Post says this: he's either unable to understand the scientific process that forms the basis of modern medicine, or he purposefully ignores the research when conclusions don't support his preconceived notions. Either explanation is disqualifying for someone overseeing the nation's health and science.
Well, I think if we listen to what he's talking about, he's very clear about what he wants to do. Number one, he wants to address corruption in healthcare and corruption in our government health agencies. A lot of people don't like that message and they're threatened by it. Number two, he wants to get back to evidence-based research, and he wants to fund research that's going to answer the big questions of our day. And number three, he wants to address the child chronic disease epidemic. A lot of people are concerned. Food supply is poisoned and kids are growing up in a toxic milieu, and we're drugging kids at scale as the American Academy of Pediatrics is pushing Ozempic in 6-year-olds. He is talking about health and chronic diseases. It shouldn't be a political message. And I think you're seeing a lot of people unite around that message. Parents, it was effective on the campaign, and I think they're delivering on that now.
And I have seen those within the medical community, your peers as well, saying we do agree with him on a lot of that stuff. Those are conversations we need to have, but they're very worried about his authority over agencies that are very important when it comes to things like vaccines and public health.
I would say people should not dissect what he said 30 years ago and listen to what he's saying now. He's saying very clearly he's not anti-vax. He's not going to remove or take away anyone's vaccines. And what is scary and dangerous to health is not RFK Jr., it's what people just witnessed. It's the food pyramid lie that's been out there for 60 years. It's the medical establishment that lied to us about opioids for 20 years, saying it was not addictive. It was the vaccine mandates, ignoring natural immunity, cloth mask on toddlers. That's what's driving a lot of the distrust of the medical establishment. It's not RFK Jr.
There are also those who object within the Republican Party because of his issues on abortion, his positions there. Former Vice President Pence, now with American Freedom, put this on X. He says he would be the most pro-abortion Republican-appointed Secretary of HHS in modern history. He says, I'm respectfully urging Senate Republicans to reject this nomination. So there's the abortion issue, too, for conservatives that they have some concerns about with him.
Yeah, I don't speak for him. I don't know his views on abortion, but I do know his views on addressing a lot of these chronic diseases and the issues of the food supply. If you look at the path that we are on as a country, it's not a good path. We're watching so many of these chronic diseases go up. Early onset Alzheimer's has tripled. Cancer in young people under age 50 has gone up by 79%. We're looking at half of our nation's children are sick. We're looking at 40% of our nation's children now with a mental health diagnosis. 1 in 5 kids is on a medication. So what he is really focused on is this concept that we can't keep drugging our nation's children going down this path. That's what's dangerous.
Really quickly, if he were to be confirmed to this position, how much authority would he have to make real progress on all those things you mentioned in maybe 4 years?
I think he wants to bring in a lot of scientists from highly respected institutions and let them do good work. And I think that's the focus. He is really the quintessential environmental health attorney of our era. And that may be the quintessential issue of our era if we look at our status in terms of health. The central issue in healthcare is the health of the population. It's not health insurance and how we finance the broken healthcare system. It's how we fix it. And so for the first time ever, we're now seeing a focus on addressing the health of our nation's children and the chronic disease epidemic. And that's exciting a lot of people.
Well, for a lot of people, it's a shock to the system. So we'll see how this plays out. Doctor, always good to see you.
Good to see you,
Thank
Shannon.
you so much.